Welcome back. In the chapter of health programs in India, in today's session, we are going to deal with elimination of lymphatic filariasis. Under the National Vector-Borne Disease Control Program, which is an umbrella program for the prevention and control of 6 vector-borne diseases. The 6 vector-borne diseases are malaria, filariasis, dengue, Japanese encephalitis, Kala Azar, and chikungunya. We have dealt about the malaria, the milestones, targets, goals, objectives, key interventions. All of the topics have been dealt in the previous videos. In today's session, we will be exclusively dealing with filariasis. To begin with, lymphatic filariasis is endemic in 250 districts. So we see that it is endemic in about 250 districts and in 16 states and 5 union territories. So it is found endemic. What is endemic? What is the meaning of endemic? Usual expected frequency. If the occurrence of disease is in the usual expected frequency. For example, now if you are expecting 100 cases of filariasis during that particular year in that area. Every year, if 100 cases are approx 100 cases are coming, then it is endemic in that area. Usual expected frequency. You expected about 100 cases and you're getting about 99 or 100 cases in that area, which means it is an endemic in that area. So we see that it is endemic in 250 districts. 250 districts, 16 states and 5 union territories. About 360 million people are exposed to the risk of infection. So we see that around 360 million people worldwide are exposed to the infection or the risk factor of the lymphatic filariasis. They are exposed to the risk of infection. Now this is about the introduction. Moving on, the National Filaria Control Program was started in 1955. So we know that the control program was launched or has been in operation since 1955. And in June 1978, the operational component of the National Filaria Control Program was merged. In 1978, this National Filaria Control Program NFCP got merged with the urban malaria scheme so that the maximum utilization of the available resources can be done. So guys, very simple, we see that it was started in 1955. In 1978, what did they do? This National Filariasis Control Program, they merged with the urban malaria scheme. They merged with urban malaria scheme. What was the reason for this merging? It is for the maximum utilization of the available resources. In the year 2003 to 4, it merged with National Vector-Borne Disease Control Program. Later, they joined with they got merged with the National Vector-Borne Disease Control Program, which is nothing but NVB-DCP. It is being implemented through 206 filaria control units, 199 filaria clinics, and 27 survey units. So guys, you can see that this National Filaria Control Program, it is being implemented through 206 filaria control units. They implemented this program through how many units of filaria control? 206 units. The program was implemented with the help of 206 filaria control units. Okay, they set up filaria control units. Which what was the number? They were about filaria control units were about 206 in number. And 199 filaria clinics. So you see the clinics were 199. And lastly 27 survey units. Clear guys? So in 2003 and 4, they merged with NVB-DCP and implemented the program through 206 filaria control units, control units are 206. Then we saw the clinics. The clinics were 199. And lastly, the survey units were 27. Fine. Moving on, the revised filaria control strategy. Now we are moving on to the revised filaria control strategy. The National Health Policy 2002 envisages the elimination of lymphatic filariasis by the year 2015. Envisages or aims at the elimination of lymphatic filariasis. It aims at the elimination of lymphatic filariasis by the year 2015. And this aim was set up in the year 2002. They aimed that by the end of 2015, the lymphatic filariasis should be eliminated. The elimination is defined as, and how did they define this elimination? They defined the elimination as lymphatic filariasis cases to be a public health problem. So this lymphatic filariasis was a public health problem. We have to seize this public health problem, and when the number of microfilaria carriers is less than 1%, and the children born after the initiation of the lymphatic filariasis elimination program, they should be free from the circulating antigenemia, which is nothing but the presence of adult filaria worms in the human body. Okay, clear guys? What is the aim? First, how did they define it? In the first place, they have to seize the lymphatic filariasis as a public health public health problem. Okay, they have to seize it as a public health problem. No more it should be a public health problem. Second thing, the carriers should be less than 1%. Thirdly, the children who are born, the babies or the children who are born, they should be free from this antigenemia. What is this antigenemia? The filarial worm in the body should not be present in them. Okay, when they are born, there should not be the presence of filarial worm in the human body. Clear guys? This was the revised filaria control strategy. Very important whenever the national program is asked. From the exam point of view, you are supposed to mention about the strategies under each program. Next, the guidelines under the National Vector-Borne Disease Control Program. So the strategy what the lymphatic filariasis elimination led through is the annual mass drug administration. So guys, you can see here, the first thing is the lymphatic filariasis, the elimination of lymphatic filariasis. You can see here. In India, what happened? The National Health Policy in 2002, they aimed at the elimination of lymphatic filariasis by 2015, right? I told you, right? In the year 2002, they aimed that by the end of 2015 there should be an elimination of lymphatic filariasis. That was the aim. So now we are talking with respect to this aim, what are all the programs or the strategies which were implemented for the lymphatic filariasis elimination by the year 2015. So you can see here ELF, that is nothing but elimination of lymphatic filariasis by the year 2015. The first strategy is annual mass drug administration. Annual mass drug administration of anti-filarial drugs for a period of 5 years or more to the eligible population to interrupt the transmission. So what are they doing? They are giving this annual mass drug administration. They are giving a single dose of anti-filarial drug for a period of about 5 years to the eligible population. So who are these eligible population? The eligible population are those babies who are excluding the babies who are less than 2 years, the people who are ill, and also the pregnant mothers, and we are eliminating such a population, and the remaining ones will become the eligible population. to interrupt the transmission. And why are we giving this annual mass drug administration? So that we interrupt the transmission of the lymphatic filariasis. This was our first step. What is that? Annual mass drug administration. Fine. Mass drug administration. Fine. Moving on. The next step was home-based management. Next, we see the second step. What did we do? Home-based management of lymphedema cases and upscaling of hydrocele operations in identified CHCs or district hospitals or medical colleges. So here we see that we are upscaling. What do you mean by upscaling? We are increasing the quality of service. Okay, or increasing the quality of service of the operations which are being performed for the hydrocele. We are improving the services in the community health centers, district hospitals, medical colleges. So these are the two main strategies. So guys, what are you going to talk about here when you write about the guidelines under the National Vector-Borne Disease Control Program for the filariasis elimination? Is the first thing is the annual mass drug administration. The mass drug administration is done for a period of 5 years for the eligible population. Very simple, so that we interrupt the transmission. The next step again, home-based management, door-to-door visits, going to the people's home, giving them the services at their doorsteps. Home-based management of lymphedema cases, and we are also upscaling the hydrocele operations in identified CHCs, district hospitals, medical colleges, etc. Now, in the year 2004, so we see that to achieve the lymphatic elimination of lymphatic filariasis during the year 2004, what happened? The government of India launched the annual mass drug administration with a single dose of DEC tablets. First thing, they introduced the single dose of DEC tablets. And the program was covering 202 districts in 2004. Fine. We see that by the November 2004, they were covering about 202 districts, and it has improved from 72.4% coverage in the year 2004. How much coverage did they do? That is 72.4% coverage. It was improved to 72.4% coverage of the population. So guys, in 2004, what will you remember? The annual mass drug with a single dose of DEC, and 204 districts were covered and 72.4% coverage was seen. In the year 2007, now in the year 2007, the co-administration was done. The co-administration of the DEC tablets and albendazole tablet has been updated since 2007, and whereby about 250 lymphatic filariasis endemic districts were covered. Here almost all the 250 districts about the lymphatic filariasis endemic districts, they were covered. Okay, and in the year 2014, 86.8% coverage was seen. So the coverage kept improving, and by the year 2014, 86.8% coverage was seen. So this is about the guidelines. Now the last point is that in 2004, they performed this door-to-door survey. Okay, the door-to-door survey in filaria endemic districts, and they did the line listing of lymphedema and hydrocele cases. The line listing of these hydrocele cases, lymphedema cases was done in 2004 by giving this door-to-door survey, by performing this door-to-door survey in the filaria endemic districts. And the second thing is the upscaling of the hydrocele operations was done. Like I told you, they upgrade or the upscaling of the hydrocele operations. And in the year 2014, the 8 lakhs lymphedema cases and 4 lakhs hydrocele cases were line listed. So the line listing was done of about 8 lakhs lymphedema cases and 4 lakh hydrocele cases. So this is all about the guidelines Very important, remember the annual mass drug administration and home based management. They did the door to door survey in this is the first two strategies you have to write. And then under strategies and also including the guidelines, you will also add about the year 2004, what happened, the mass drug administration of a single dose of DEC tablets. And the second thing in 2004, door to door survey. Okay, door to door survey. Next, 2007, the co-administration of DEC tablets along with albendazole. Okay, this co-administration of the DEC tablets of albendazole was done. And then we saw that in 2014, the coverage improved for about 86.8%. And in 2014 they had 8 lakhs lymphedema cases and 4 lakhs hydrocele cases uplisted. Okay, moving on, the last point, that is the initiation has also been taken to demonstrate the washing of the foot. The simple washing of the foot was demonstrated so that the people can maintain the hygiene and prevent the secondary bacterial fungal infections in the chronic lymphedema, cases, so that the patient gets relief from the frequent acute attacks. When the patient gets this frequent acute attacks, to prevent this frequent acute attacks, they taught them the simple washing of the foot. So this is all about, you can just see the picture here. They are demonstrating the simple washing of the foot in cases of filariasis infection, so that they can prevent the patients from entering or contracting this bacterial fungal infections secondary to lymphatic filariasis. So this is all about the program Elimination of Lymphatic Filariasis. The key points, let us just brush through the key points. It comes under the National Vector-Borne Disease Control Program. It includes the 6 vector-borne diseases. Name them and tell. And now we are going to discuss about filaria. First, you need to name all of the 6 vector-borne diseases which fall under this NVB DCP. Following, you can say how many districts it was endemic. It was endemic in 250 districts, 16 states and 5 union territories. And about 360 million people are exposed to the risk of infection. We see the control program, it was launched in 55. Okay, fine. It was launched in 55. In 1978, they merged with National Filaria Control Program, merged with the Urban Malaria Scheme. And 2003 and 4, it merged with National Vector-Borne Disease Control Program. And how did they work towards the elimination? By setting up filaria control units, filaria clinics and survey units. We saw the numbers. And next, moving on, the revised filaria control strategy, wherein the elimination of filaria control, the elimination of lymphatic filariasis was aimed by the end of 2015. They expected that they have to cease this lymphatic filariasis as a public health problem. Second thing, the filaria carriers should be less than 1, and the children who are born to this lymphatic filariasis infected people, they should be free from this antigenemia. Okay, and this was the aim. And then if they ask about the strategies and guidelines, you can see the elimination of lymphatic filariasis in the year 2002. They aimed that by the end of 2015 they have to eliminate the lymphatic filariasis in the country. So the first strategy was the mass drug administration, and the second thing was home based management of the cases. And now in the year 2004, what happened? They gave this DEC tablets, single dose of DEC tablets. Later, and the door-to-door survey was done for the home-based food care, and upscaling of the operations was done. Later on in the year 2007, they merged. Okay, they gave 2 things together, that is DEC tablets and albendazole tablets. That is nothing but the co-administration is what we saw. Next, we saw that in the year 2014, the line listing of lymphedema cases and hydrocele cases was initiated by this door-to-door survey. With the help of this door-to-door survey, what did they do? By this door-to-door survey, they upscaled 8 lakhs lymphedema cases and 4 lakh of hydrocele cases. Okay. So, and also they taught them the simple washing of the food to maintain the hygiene to prevent the secondary bacterial fungal infections in the chronic lymphedema cases. So, patients get relief from the frequent acute attacks of lymphatic filariasis. So, with this, we come to an end of elimination of lymphatic filariasis. I hope everything is clear. If you like the video, hit the like button and subscribe.